Hey guys, it's HINA here at Rebalance Physical Therapy in Narberth, Pennsylvania and in Philadelphia, Pennsylvania. And today I want to talk to all of you guys who may have had removal of their coccyx bone or even part of their sacrum, and now, years later, might be experiencing issues with sitting, any type of constipation, or potentially other low back issues and, other kind of sequelae of removal of your coccyx bones. Perhaps you went and you talked to your healthcare providers, your physicians, maybe even you went to a physical therapist, and they weren't quite sure what to do, or even that they thought it was related to some of the issues that you're having now. But for many of you, we see patients like this frequently. And I can tell you that, yes, removing the coccyx bones, even part of the sacrum, can actually have an effect on the rest of your body. And I want to talk to you why. So, again, this is a model of the pelvis, okay? And these are the two pelvic bones right over here, okay? This is the pubic bone here. And in the back side, this is where your spine would attach. And then this is your sacrum, and then there is your tailbone right over here. Now, if this tailbone or even part of the sacrum was removed for whatever reason, okay, then what could have happened is there's a lot of muscular attachments to the tailbone as well as to the sacrum. And this muscular attachment, part of it is the pelvic floor, okay, which is a hammock type muscle that basically starts at your pubic bone, and then it circles around and it hooks onto your tailbone, okay? And there's lots of muscles in this area, 16 plus muscles of your pelvic floor. Most people think of a pelvic floor as one muscle, but it's actually several different muscles, and they have different attachments to many different areas. One of those being the tailbone as well as part of the sacrum. And if these muscles were attached here, okay, and you had this bone or part of this bone in the sacrum removed, then what happened to the muscles that were attached to that area? And I'm not sure, depending on the surgical procedure you had, this is something you could potentially get your operative report or even talk to your physician about what they did with that musculature. But chances are they may have not even done anything. And so what ends up happening is these muscles can become dysfunctional. And the rest of the muscles have to, if these muscles aren't working correctly anymore because they were either resected or cut off, okay, then the rest of your muscles are probably going to compensate or overwork potentially to make up for the fact that these guys are no longer working anymore. And if these muscles get super, super tight, okay, because they're overworking, and then it can affect everything from sexual function to emptying your bladder to emptying your rectum. Okay, so that's going to interfere with constipation, and it can interfere with intercourse, and it can interfere with emptying your bladder. And it can cause everything from urinary frequency, meaning you feel like you have to go all the time. It might even give you burning with urination. It can give you pain with having a bowel movement, or again, related to constipation because now you can't sufficiently relax these muscles for the stool to come out. But the other thing is it can also create a lot of hip pain, and the reason why is because a lot of this musculature, okay, two muscles in particular are called the piriformis and the obturator internus, actually hook on to the hip. And it could also cause low back pain because part of the role of these muscles in the pelvic floor is to actually help to stabilize the pelvis as well as the spine. So for some of you who might be having sacroiliac joint pain, which is this joint right over here, this sacrum attaches to a pelvic bone, and this is called your sacroiliac joint. So if you have pain in that low back, or even pain in your lumbar spine, or even changes in your lumbar spine, this could be something that has developed over time because of the change due to the removal of the coccyx or the sacrum. Now, you may have had to have this done, and there was no other choice around it, but treatment is available to help get these muscles working again in a more efficient way and not be so tight. And this is where working with an integrated pelvic floor and orthopedic physical therapists can really help because they understand how all of this is interconnected together. So if you are suffering from issues that you've developed from, removing, again, the coccyx or part of the sacrum, then this little demonstration that I just showed you can actually, be creating all potentially some of the issues that you're having. And not only in the spine, because I just had a patient actually call me just yesterday, and she was talking about how this has actually started to affect up into her shoulder. But when we started talking about her history and everything that has happened, it kind of boiled down to this is what started things initially, and it kind of just worked its way up. So again, if you're having these issues and you live near the Philadelphia area or the main lines of Philadelphia, or even, we have patients coming from 2 hours away, then definitely give us a call, and we can kind of help you figure out what might be going on. And if you don't live in this Philadelphia area, then you can come onto our website. You can send me an email and I can help you figure out who you might be able to see in your area that might be helpful. But you really do want to look for an integrated pelvic floor therapist. You can Google it, integrated pelvic floor physical therapist, that again treats both orthopedics as well as pelvic floor issues and understands pain, constipation, and how everything is related. So I hope that was helpful to some of you and you found this information, you can relate to the information that I just gave you. And I hope all of you guys have a wonderful day.